You heard from varicocele. What is a varicocele?
Okay. Varicocele is usually varicose veins in the scrotum, which is on the cord.
Like the veins, like an old lady gets in
like
the
an
leg?
old lady gets in the leg. But this happened in the cord, in the spermatic cord. Most of the time, the most common site of the varicocele is usually the left, less on the right. A lot of them are bilateral. And what happened is that this thing, you don't see them before puberty. They usually start after puberty. And they have to do with the testosterone that the testicles produce. That testosterone produces dilatation of those veins. And since the veins, they drain all the way up. On the left side, they drain into the kidney. On the right side, they drain into the vena cava. There are no valves on those things. It's like somebody that stands on his feet all day long. And they damage the valves over there onto the vein, and they get those things. The analogy that you just said. Same thing happens over here.
How do you handle it?
The varicocele, if it happens in an elderly person, you do nothing.
I'm talking to a kid 15, 16, 17 years old.
You have to tell him that there is a possibility. If the kid has not proven his fertility, if he's not married, and he's not interested in getting married, and he's only 15 or 16 years old, you got to tell him that eventually this may cause fertility problems. Because eventually it cuts down on the motility and the morphology of the testicle, of the sperm.
Do a surgery?
And you have to do surgery on them if they cause this thing. But if the kid is at the age of 15, you don't have a girlfriend, and you're not planning to get married over there at the age of 15, you can't get married until the age of 18, so there's no reason to tell them that if I don't do this thing right now, you're going to get a fertility problem. Most of the time you observe them, unless you get a grade 4, which basically it feels like a sack of worms in the scrotum. Then they are so big that eventually that thing is going to produce atrophy of the testicle. Because of the weight of the blood, the testicle is going to shrink, and it's going to get much smaller. And this has been proven, that you follow these kids over the period of years, you do sonograms of the testicles gets smaller and smaller and smaller, and eventually it shrinks itself away. Now, anything that happens to the left side will cross over to the right side. So, the varicocele is on the left side, but it produces damage on the flow of the blood over there to the right testicle also, and it causes infertility problems.